Hi, my name is Dr. Glenn Krieger, and if you give me 3 minutes, I will tell you about a concept so revolutionary that it will change your practice and your life forever. An approach so unique that it has clinicians all over America telling me that their case acceptance has skyrocketed and their team cohesiveness grown. In 10 years of lecturing around the world to thousands of dentists, I stumbled upon a weakness in case presentation that, once corrected, makes all the difference between success and failure in our dental practices. You see, I've also been a practicing dentist for 20 years. We live in unprecedented times. Our practices went from humming along to facing the worst economic crisis in over 80 years. Wouldn't it be great if we could turn the hands of time backwards and undo this entire mess? Well, we obviously can't do that. But what if I could show you a way to make more money, seeing less patients, treating them in an honest and immoral way, while reducing your stress and developing the type of practice that you've always wanted? Does it sound too good to be true? Well, it isn't. How do I know? Because the process I'm going to talk about has been used by me and many of my students with great success. But first, let me tell you where our profession had it all wrong. Have you ever had a patient seem engaged in a proposed treatment plan, only to walk out of the office without scheduling? Or maybe you had a great rapport with a new patient, only to see a transfer of records request faxed to your office the next day. It's not your fault. It was simply a product of what we weren't taught when it came to case presentation. When our world went digital, gone were the days of having to work with slides or lengthy processing times for pictures. We suddenly had a new world open up for us because we could capture images and then suddenly show them to patients. The concept of digital case presentation was born. For the first time, we could capture images, sit a patient up, and show them their problem. But then we made a big mistake. Instead of making the patient our partner, we accidentally took them for a ride, and case acceptance suffered. Think of it this way. You're driving down the road with the patient in the passenger seat, and you've been driving for a while. Suddenly you look at the patient and realize they're hungry. So, assuming you're doing the patient a favor, you pull over to the first restaurant you see and buy them the daily special. What if they don't like it? What if they don't like the restaurant? Worse yet, what if they don't even recognize the telltale signs that they're hungry? Now imagine the same scenario, but this time you ask the patient if they're hungry before pulling over. If they say yes, perhaps you ask them what kind of food they want to eat, and then look for a restaurant that fits the bill. When you get there, wouldn't it be nice to let them choose what they want to eat? This subtle change in approach will make all the difference, and we can apply the same concepts to digital case presentation. The ensuing product is so effective that I named it digital co-diagnosis. It's simple. We use digital images to allow the patient to co-diagnose the case in such a way that they actually become our partner. They're engaged and, more importantly, aware of their problems and engaged in wanting to solve them like never before. At the Krieger Continuum, our courses will teach you and your staff how to effortlessly capture images better than you ever dreamt possible. But more importantly, we'll teach you and your team how to use them for unmatched case acceptance and patient engagement. We'll even teach your team the verbal skills necessary to walk patients through the entire process from beginning until end. Our courses are designed not just for the dentist, but for the entire team. As a practicing dentist myself, I recognize how important it is to have an advocate aside from yourself in the office in order to implement any system. Sign up for one of our courses today at www.kriegercontinuum.com, and let me show you how you can stand out in your community and increase your bottom line, even in this economy.